One of my patients I saw in clinic today had his mitral valve repaired 6 months ago. The mitral valve is one of the 4 valves in the heart. It is this valve here, in fact, which separates the heart from the lungs. And this patient had developed an infection of this valve, and it had destroyed a large part of the valve and caused it to leak. So a lot of blood which should be going out of the heart was now going backwards into the lungs, and this was causing him to be quite short of breath. In addition, the infected valve was very friable. It had formed what is called vegetations. So these are loose infected tissue within the valve, and it is at risk of what we call embolizing, going to a different part of the body like the brain and causing a stroke. So he needed surgery to repair the mitral valve and make it competent again so that it's not leaking, and also to get rid of all the infected tissue. So essentially what we had to do was we had to remove all of these vegetations, and then we had to cut off the unhealthy valve tissue and leave just the normal healthy valve behind, and then we had to reconstruct the valve back into a normal healthy competent mitral valve. And at the end of that, we have to suture what we call an annuloplasty ring around the valve to re-support it and to ensure that the repair will last the lifetime of the patient. So I saw him this morning, and I'm very glad that he is completely recovered from his surgery. He does not need any medications apart from some cholesterol medications because his cholesterol is rather high. One of the advantages of repairing the valve instead of replacing it with an artificial valve is that he does not need any strong blood thinners. He's not on any anticoagulation or any antiplatelets because it is all his own tissue. And after a year, all the tissues have what we call endothelialized. The cells have formed over the valve tissue, so there's no need for any blood thinners. And that is one of the advantages of repairing the valve. And the valve looked very good as well. There's no leakage and should last his lifetime. So thank you for listening. I hope that was informative, and do share this video and like it if you find it useful. Thank you.